Hi, I'm Marvin Plackett, and today is Thursday, January 21st. Greetings to all residents, to all staff, and to all guests. It feels like a very long time since I have seen you. It's been a week. Maybe it's been a long week. In any case, good to be back with you. We currently have 6 active cases of COVID-19 at this time. None of those are residents. We're delighted to report that. None are residents. And 6 are staff. And those 6 are at home recovering, and of course will not be scheduled until they have fully recovered and they're fully back on their feet and no longer contagious. So we wish them well, of course. We're certainly pleased that, especially in this environment of the variant of the virus that is more contagious, we're so pleased that it has not seemingly penetrated our communities at all. 0 residents at this time, so we're really delighted about that. So vaccines, you've heard me talk about this before. So half of our communities now have either gotten the vaccines or are scheduled to get it. So both of our skilled care, that is the Gardens and Episcopal Church Home, Iris Park Commons, our assisted living, they are scheduled to receive it Monday next week. And 2 of our independent living have already gotten it, Kings Crossing and Cardi Heights, and 1 more has just gotten scheduled to receive it. That is the Midway Point. And so we are making progress. A reminder, it's between the health department and the pharmacies of Walgreens and CVS pharmacies that do all the scheduling. They just tell us when it's getting scheduled at our communities. We have no choice in terms of priorities or dates, times. They just say, here's the date, here's the time, here's the community, that's it. So just letting you know that that is out of our hands. All of the managers of all of our communities have reached out multiple times to work on getting scheduled as soon as possible. And of course, here at Episcopal Homes, as I've mentioned to residents, to staff multiple times, we are fully embracing this vaccine. It is the best weapon by far. So we all want to take the vaccine, all residents, all staff. Until though everyone has it, we must continue to employ the measures that we know that make a big difference. And that is wearing a mask at all times, staying at least 6 feet apart for the physical distancing. Those measures really matter, especially with this more contagious variant. We must be employing this at all times. So thank you for your cooperation. And of course, frequent hand washing. And if you have any symptoms, self-isolate and get tested. That's really, really vital that we follow these measures. I want to also remind everyone on that front because I occasionally see these missteps, and I know you do as well. And that is some people wearing the mask where it falls beneath the nose. And that's not okay. For the mask to be fully effective, it has to cover the mouth and the nose. Okay, so that's really important. Keep that in mind. And if you see someone who isn't doing that, politely ask them or just remind them, say, you know, not sure you're aware, but the mask needs to also cover the nose. Okay, so I do that all the time when I see it. And people respond very nicely, very appropriately. And so I encourage all of us to do the same thing in a nice, friendly, supportive, loving way. All right? Let's see. I think that is most of what I had to cover on that front. Now I need to read the birthdays, because we would have done that on Monday, but we didn't have a meeting on Monday. So here we have birthdays. And if I make a mistake on your name, I apologize in advance. Charlene Bolt, Iris Park Commons. Joe Lotsfeld, Cornelia House. Joan Menegel, Iris Park Commons. Bobby McGee, Midway Point. Patricia Okaya. Okay. Patricia Okaya, Episcopal Church Home. Robert Kearns, The Gardens. Ephraim Ashabo. I'm sure I'm not doing that justice. Sorry about that. Ashabo. Ephraim Ashabo, Kings Crossing. And Sheila Beck, The Gardens. Happy birthday to all of our birthday people this week. Okay, Well, let's see. So since it's Thursday, I will be seeing you on Monday, this upcoming Monday. We're going to end, and I wish you a very good weekend. Remember, a safe weekend. Take care. And I was going to mention also a quote from the Star Tribune today. In case you're wondering if, as soon as we get the vaccines, why can't we then relieve ourselves of the masks or physical distancing? And there are multiple reasons, but here's one. So far in Minnesota, okay, 200,840 Minnesotans have received the vaccine, at least one shot so far, okay? That is 3.5% of all Minnesotans. That's all it is, okay? We have 5.6 million Minnesotans, 200,000, just over 200,000 have received it, 3.5%. That's why we have to still wear our masks and do the physical distancing, because we're not even close to reaching herd immunity. And the other big reason is because just because one might be immune themselves as a result of receiving the vaccine, what we do not know is whether or not one can still be a carrier, even if they are immune. And so that's the other big reason why continuing to wear our masks and physical distancing is important even after we receive the vaccine shots, at least for several months, okay? We'll certainly keep you posted on that front, because I don't want to be wearing my mask longer than I need to. You don't want to, I get it. So when we can shed these, you will know. We will keep you updated. All right, take care, everyone. Look forward to seeing you on Monday. And now our Joy Ambassador, to wrap up the session today, we have with us, I need to make sure I get the name completely right, first and last name, and we have Margot Arnold from Cornelia House. Welcome, Margot.
Hi, I'm Margot Arnold from Cornelia House, and because of the inauguration yesterday, I thought it was really important to do something patriotic. And I came across the poem that I read actually in October when we did the Sage Singers concert. Joey found this poem called Of History and Hope by Miller Williams. We have memorized America, how it was born and who we have been and where. In ceremonies and silence we say the words, telling the stories, singing the old songs. We like the places they take us, mostly we do. The great and all the anonymous dead are there. We know the sound of all the sound. We know the sound of all the sounds we brought. The rich taste of it is on our tongues. But where are we going to be, and why, and who? The disenfranchised dead want to know. We mean to be the people we meant to be, to keep on going where we meant to go. But how do we fashion the future? Who can say how? Except in the minds of those who will call it now. The children. And how does our garden grow? With waving hands, oh rarely in a row, and flowering faces, and brambles that we can no longer allow. Who were many people coming together cannot become one people falling apart. Who dreamed for every child an even chance, cannot let luck alone turn doorknobs or not. Whose law was never so much of the hand as the head, cannot let chaos make its way to the heart. Who have seen learning struggle from teacher to child, cannot let ignorance spread itself like rot. We know what we have done and what we have said, and how we have grown, degree by slow degree, believing ourselves toward all we have tried to become, just and compassionate, equal, able, and free. All this in the hands of children, eyes already set on a land we never can visit. It isn't there yet, but looking through their eyes, we can see what our long gift to them may come to be. If we can truly remember, they will not forget. Thank you.